internal parasites, nematodes, cestodes, trematodes, internal parasites, nematodes, cestodes, trematodes. The most important internal parasite of poultry belong to the nematode. They have spindle-shaped bodies with tapered end and are also known as roundworms, ascarids, cecal worms, Heteracus gallini, capillaria, tapeworms or cestode are flattened, ribbon-shaped worm composed of numerous segments or divisions. Roundworm Roundworm life cycle: eggs are shed in the host, drooping. Infection is established when a bird ingests an embryonated egg from the environment. Direct life cycle, or when the bird consumes an intermediate invertebrate host that is infected with the parasite. Intermediate life cycle. There is intermediate life cycle and direct life cycle. Direct life cycle: the bird ingests the embryonated egg. Indirect life cycle: the bird consumes the intermediate vertebrate host that is infected with parasite. Ascarids, large intestinal roundworm, one of the most common parasitic roundworm of the poultry. Ascaridia galli occur in the chicken and turkey. Adult worms are about 1.5 to 3 inches long and about the size of an ordinary pencil lead. Heavily parasitized birds may be droopy, emaciated. Birds may be droopy, emaciated, and show signs of diarrhea. Feed efficiency is usually impaired. In severe cases, is the egg under the microscope of the Ascaridia, and this is Ascaridia from the intestine opened, heavily infested bird, and here Ascaridia in the intestine open. The life cycle of this worm is simple, with no intermediate host. Female lay thick, heavy shelled eggs uh, in the intestine that pass in the feces. Over 2 to 3 weeks, embryo develop into the infinitive stage in the egg. The embryonated egg may stay viable for a long period. Birds become infected by eating eggs that have reached the infective stage. Normal cleaning and inspection agent don't kill the egg. Cecal worm. These worm Heteracus gallini are found in ceca of chicken, turkey, and other birds. The worms themselves are not considered a major threat, but they are highly considered a major carrier vector for the agent that cause blackhead, Stominus mediocridis. Eggs are produced in the ceca and pass in the feces and become infective in approximately 2 to 3 weeks. Here we find this characteristic for the Heteracus under the microscope, and this is the worm, and this is the intestine open, and this is the egg under the microscope, and this is the life cycle, it's direct life cycle, but the egg need to be embryonated after 2 weeks. Heteracus callini or cecal worm. Capillaria or threadworm. There are many capillaria species that affect birds, but in commercial poultry, the commonly encountered is Capillaria annulata, Capillaria controta. These occur in the croup and esophagus of the host. This may cause thickening and inflammation of the mucosa. This is the appearance of the form Capillaria, and this is character shape of the egg under the microscope, and this is the table, T like here. This is the worm. It's relatively long. The life cycle is directly adult worm are embedded in the lining of the intestine. Eggs are laid and passed in the drooping. Embryonating occurs in 6 to 8 days. Here the direct or indirect. The capillaria is direct. Life cycle is direct. The cestode is indirect. Life cycle of cestode is indirect. Tapeworms or cestodes are flattened, ribbon-shaped worm composed of numerous segments or divisions. Tapeworm vary in size from very small to severe inches in length. Most commonly found in the poultry are Reliatina, Cysticillus, and Conatina infundibulum. Tapeworm has characteristic shape like ribbon shape, and segmented, divided. Tapeworm use intermediate host for their life cycle. Birds become infected by eating the intermediate host. These hosts include snails, slugs, beetles, ants, grasshopper, earthworm, houseflies, and others. The intermediate host become infected by eating the eggs of tapeworm that are passed in the bird feces. And this is the life cycle here, indirect, as we mentioned, and this is the intermediate host. In modern commercial poultry systems have a lower incidence and worm burden by the less access to the many parasite intermediate hosts. However, the incidence in the backyard and free-range flocks can be high with a significant worm burden. Control measures that interrupt the life cycle are effective for most nematodes with direct cycle of infection, for parasites with indirect life cycle. Some nematodes, cestodes, and trematode control is often aimed at elimination of the intermediate host, such as beetle and other insects, snail or slug, or preventive access of the poultry to intermediate host. Piperazine is the only Food and Drug Administration approved treatment for internal parasites in meat and egg producing fowl. Others are allowed for non-meat or egg fowl. Fenbendazole has been used as a feed or water additive, has been successfully used against capillaria and Hedractis infection. Thiabendazole, mebendazole, carbendazole, levamisole, tetramizole have been used against gametes and other nematodes such as Trichostrongylus. Parental tartrate and citrinine have also been effective against some nematode infection. uh, Butyrate is approved for treatment of some cystode of chicken. Blood-borne protozoal parasite. Diagnosis is generally by microscopic evaluation of the blood smear or histological section. The parasite can be differentiated by their tissue distribution, size, and physical characteristics. Prevention and treatment. These diseases are rarely treated. Few effective treatments are known. Clopidogrel has been administered in the field to Turkey for treatment of leukocytosis. With the dose weeks with apparent success, prevention is attempted to vector control. Sorry, toxoplasma, a coccidial protozoa that primarily parasitized captive and possibly wild uh, Basarian birds. The parasite is separated by fecal oral route. The life cycle consists of an intestinal and extra-intestinal form. The oocysts are shed in the dropping. Toxoplasma is famous in human and cause infertility in, and miscarriage in the woman. Differentiation of the oocyst from azospora based on microscopic evaluation. This is maybe the cycle. Sometimes cat enter in the cycle with the bird, and this is the histopathology, and this is the quill or the parasitized quill, and the appearance of the carcass. and the histopathology. The sporulated oocysts have two sporocytes and four sporozoids. Acute death may occur in young birds. Older birds may be chronically infected and show no signs. Tumor-like lesion may be present in the liver, spleen. Chronically infected bird. The parasite can be visualized. Hemoproteus. Hemoproteus belong to the family Plasmidae and share similarities with Plasmodium and Leucocytosome. Over 120 species have been reported from birds, mostly in the wild waterfowl, raptors, Pezerian, and other infection in host-specific, the Hemoproteus. Hemoproteus miliagridis, which has been diagnosed in domestic and wild turkey, Hemo- Hemoproteus columbi, Hemoproteus saccharoi in pigeon and doves, and Hemoproteus nitocins in waterfowl. Hemoproteus miliagridis has developed severe lameness, diarrhea, depression, emaciation, and anorexia and anemia. Leukocytosome description. Leukocytosis is an acute chronic protozoal disease of birds, including turkey, ducks, geese, guinea, fowl, and chicken. The disease was first observed in the wild bird species reported in Turkey in 1895, and this is the appearance of the protozoan parasite under the microscope. Birds appear to be the only host of most leukocytosomes. The etiological agents are leukocytosome, but their classification may be inaccurate. Commonly applied name. The parasites undergo sporogony in the insect and pass to the glands in their oral cavity. The insects then act as a vector and transmit leukocytosome to young susceptible birds on which they feed. Birds that survive the disease become carrier in turn. Clinical signs. There is usually a sudden onset and numerous birds soon. The signs there is depression, anorexia, first loss of equilibrium, weakness, anemia, then be rapid labored breathing. The course often is short and affected birds die or improve within few days. Mortality varies but often is high. Hepatomegaly, evidence of anemia. The most pronounced lesion often in splenic enlargement. Microscopically, gametes usually are seen within enlarged, distorted erythrocytes, leukocytes, or both types of cell on blood smear stained with red or gamma stain. Histologic section of the liver and the brain often reveal megaloschizomes or schizomes. Plasmodium infection has been rarely reported in domestic pigeon, canaries, turkey, penguin, falcon, bald eagles, and the clave swallows. Plasmodia species are often not host-specific. The parasite causes disease similar to malaria in man and is spread through the injection of infected blood by mosquitoes. Vector parasites are found in the red blood cells inside the blood. The Plasmodium is famous. Trypanosomas, motile protozoa found in the plasma of numerous species of wild domestic birds. This is the after smear of blood under the microscope after staining with GEMSA, and this is the appearance of the protozoan parasite under the microscope. A wide range of insect vectors include mosquitoes, chilicoides, or hippopotae, black flies, mites, and simulids. Protozoal infection of the digestive tract, coccidia, eczematiasis, histoniasis, trichomoniasis, other protozoan parasites, cryptosporidia, and sarcosporidia.